Community members gathered today for an update on Niagara's Infant Mental Health Initiative.
We are increasingly seeing that social, emotional, and behavioral difficulties with children and families are not getting better. The behavioral issues, the acting out, all those sorts of things, the ADHD, whatever it might be, that's not getting better. And it all tracks back to infancy.
This second annual symposium explores infant mental health, which is defined as the social, emotional, and cognitive well-being of infants and young children.
This particular initiative is especially focused on the very first few months of life, so infant child development, the development of a secure attachment relationship with one's parent, one's caregiver, because that's the social emotional basis on which kids then are able to sit, develop, grow. I think the understanding that infants, in fact, do experience a deep and rich emotional life, and even though their language is limited, it's cooing, it's smiling, it's burping, it's withdrawing, it's showing fear, what it's telling us is, just like on the parent side of things, those little eyes looking at you are trying to understand and experience the emotional environment that they're in. And that's critically important in terms of how they're then able to do all the other tasks in life that they need to do.
What about stress in terms of wellness of the infant?
Yeah, what we're learning is that stress is experienced by babes. Stress in the family environment is absolutely picked up by babies, and it does alter, we believe, their stress response cycle. So there's some good science coming out saying that we need to mitigate that, mediate it. And so a parent caregiver's ability to, on secure attachment, be able to mediate those experiences for a child is important.
We understand more than ever the importance now of that mental wellness interaction for both the parent or caregiver and the baby. And I'm just so proud because people are talking now, especially here in Niagara, through this project, really highlighting the support that parents need, all parents to some level, on how to best nurture their babies, but deal with their own coping and their own resilience to bring out the best in their baby's needs.
Dr. Chaya Kulkarni, Director of Infant Health Promotion at the Hospital for Sick Children, is also a member of the advisory committee here in Niagara. And what were the basic goals of the project initially?
Yeah, I think number one, to increase knowledge about infant mental health, because that was still not an area that people really understood well, and they didn't understand the science behind it and how they were going to put that into what they did with kids on a day-to-day basis. So one was the knowledge awareness, building their skills in terms of how to work more closely with infants, especially when they're vulnerable to poor developmental outcomes. And the third was improving those outcomes. So can we actually get kids to a better place developmentally if we are more knowledgeable, more skill-based, and we use tools and resources that are really designed specifically for infants and toddlers.
Niagara's Infant Mental Health Initiative will continue to acquire data and speak up for those who cannot speak for themselves. In St. Catharines, I'm Brenda Schultz reporting for The Source.